All right, so let's give this scenario. You get your lab results back. It looks like, all right, my cholesterol is 300. And you get this confused look on your face because all you see is this highlighted number. You get this highlighted number, you look confused, you look concerned, you're scared, and you start fumbling because you don't know what to do. You don't know if your doctor's about to tell you, hey, like this is the end for you. You're just like out of it. And that is a very common feeling that a lot of people get when they get their blood work back. Like, so obviously this month we're talking about preventative care and getting your screenings and your checkups done. And a lot of it is centered around checking your blood work. So today we're going to talk about some common things that you typically will see in your blood work. We'll give a little bit of explanation so that you aren't like scared, right? Because you get something that looks to be abnormal, especially if your doctor doesn't do a good enough job explaining it. So hopefully today we do that. I'm yours truly, Dr. Pierre, co-founder of Pierre Medical Consulting, Autism in Black, host of Medicine Mondays, and the author of Your Health, Your Choice, Your Future. And today we're going to talk about what your blood work really means. All right, so today we're going to talk about some major, very common blood tests, and I'm even going to throw in some screening exams as well that we get during our pursuit of preventative medicine and preventative care. We're going to talk about why they're important. We're going to talk about what to expect, what to look for, and more importantly, how can we make sure we are managing ourselves appropriately as we move down our mission of the preventative side of health versus the reactive side of health, right? So let's talk about this. Of course, with blood pressure, we're going to talk about cholesterol, your A1C. That's a big one as well too. CBC is a big one too. My thyroid folks, right? And then we'll throw in, like I said, we're going to throw in a couple of exams, right? So let me tell you, right? And I always say this from a cautionary standpoint, right? A lot of the things that happen in medicine, especially when you as the consumer, you as the patient gets confused by it, isn't by accident, right? Like obviously there's a reason why, doctors, do all of the schooling that they do, right? Because it is very complex. So it's, even though, right? And especially in this day and age where, you have all of these AI, ChatGPT, Claude, and all of these things that can give you an answer and maybe not be able to give you the understanding that you need to lead you away, right? Like there was a big thing, especially when I was in residency, right? And that's when like WebMD and everything was like really huge. And there was this almost like this pushback, especially from the healthcare side, because obviously you had this site, did a great job kind of explaining things. But unfortunately, because it's a site and because, they got to protect themselves, it don't matter what you searched on there, you almost ended up always having cancer, right? Like you were just like, hold on, like I just went for a headache and it's telling me I might have brain cancer, right? And then what happens? You get scared, you go into your doctor and say, Doc, I think I have cancer because WebMD told me I have cancer, right? So I suspect a lot of these same things are going to likely start happening, especially with AI, to the point now where a lot of these AI machines, like whether it be Gemini, whether it be OpenAI, whether it be Claude, if you start asking medical questions, they got a prompt ready to say, hey, by the way, right, we do not take any liability from any answers we give you, right? Because again, right, they understand like, hold on, y'all are actually skipping going to your healthcare professional and coming to us. We do not want that liability in case y'all mess around and do have cancer. And you figure like, hey, ChatGPT said everything's all good in the hood. I don't need to go to the doctor. And then lo and behold, you got no one to look at when something bad happens, right? So let's talk about, just that aspect of understanding that the system of healthcare, especially when we talk about, these labs and these testing are meant to be confusing because they are pretty complex, right? And I've said this before, I've had episodes where I talk about sometimes you have a test that, is deemed abnormal and your doctor says, oh, we'll just keep an eye on it, right? You got to know, right, when to keep an eye on it, when to kind of monitor it, when to take action upon it, right? So we're gonna do that first and foremost, right? And again, I love this. Like understanding blood work changes everything because blood work is data, and data tells a story. Quite often, especially when I was training, a lot of my attendings would tell me that when we, especially as a resident or even medical student, would order tests, is because we already had something in mind. And I find, especially in this day and age, where people are ordering a test hoping to find something versus ordering a test to confirm what they think, if you understand the difference, right? Again, so I'm not ordering a test because I hope something is there. I'm ordering a test because I think something is there, and I need this test to confirm or deny, right? Like, it's a different philosophy, but when you got a good doctor, right, it makes all the sense in the world, right? Because again, that's that preventative measures, right? We're not ordering $1 million worth of tests when you don't need $1 million workup. Right, that's what it is, right? And I used to do, especially at the outpatient medicine, all the time. Patients would come to me and say, "Hey, doc, I want all of these tests right here." And I look, I'm like, "All right, yeah, but like, why do you need all of these tests right here, right? Just to see if they understand, like, hey, just because you get this test done, you got to be able to do something with the results, right?" So we're going to talk about the results, and like I said, I focus on this aspect of making sure your blood work is important, make sure you understand your blood work, more importantly, making sure you're getting it done, right? You got to, because none of this matters if you're not getting your blood work done, right? So you got to get your blood work done if again you want to live healthy and wealthy and spiritually and mentally. If you want to do all these things when you're old, like, you got to start doing these things now, right? So let's first talk about blood pressure, right? Blood pressure is a big one because when it's probably the most common thing that gets done, right? You go to any doctor's office, hell, you go to a pharmacy, right? Like, there's gonna be a blood pressure machine somewhere. You go to a health fair, someone is taking blood pressure, right? Blood pressure is extremely important. In fact, I'm taking care of a person right now who's 42 years old. I'm 41. The person is 42 years old, right? Young guy, right? Because we're young, right? Young guy, 42 years old, comes into the hospital with serious, significant headaches, right? And thankfully, right, he had a loved one who said, "Hey, you got to go to the hospital, man. This headache is bad," right? Ends up having a stroke due to a brain bleed because his blood pressure was so uncontrolled. And that's not where the story stops, unfortunately. Because what typically happens, and I've said this, what typically happens when you have blood pressure, your body will do a good enough job trying to do all it can. It will do a good enough job trying to do all it can while getting beat up in the meantime until it can't no more. So not only in our workup for this person who's now had a stroke at 42 years old from a brain bleed because the blood pressure is uncontrolled because he just was not taking it. It's not like he didn't know he had blood pressure issues. He just wasn't taking his medication, right? We just said, "Hey, what were those words? I feel fine." Deadly words in medicine, right? I feel fine when he was not fine. His body was not fine. Got so bad that when we were doing in our workup, we did an echocardiogram of his heart just to see, all right, let's see how the heart's functioning, just to make sure, again, we got to, we're crossing all of our T's, dotting all of our I's. He had an ejection fraction of 10%. Just to give you some context, typically a normal person should have an ejection fraction, and this is how well the heart functions or how well the heart beats, just for layman's terms purposes, is like 60 to 65%. That's a normal person. His was 10% at 42 years old. So now this thing that, I felt fine, this blood pressure that he ignored for years, not only has now caused him to have a stroke, now he has cardiomyopathy, right? So again, blood pressure is extremely important. There's two numbers, right? There's a top number, there's a bottom number, right? And there are different stages of the numbers, right? And I want you to kind of get us in the grading scale, right? Because again, understand, right? And I like this, right? Think of it like water pressure in a hose. Too much pressure, the hose breaks. Too much blood pressure, your arteries break. That is what's happening when you have high blood pressure, right? It's so much pressure, and your heart has to work so hard to do the same amount of effort. It eventually gets so weak that it can't do it anymore, right? So that's why his ejection fraction was down to 10%. Again, these are some issues, right? And these are, like, when I think about blood pressure and the numbers, right? This is what I want you to know, right? I want you to know, hey, where do I live at in the blood pressure scheme of things? Normal blood pressure, a normal person, again, I don't care what your age, 120 over 80. Top number 120, bottom number 80. If you're below that, you are considered normal, right? That's the person. I'm not, again, it could be genetics, could be good blood pressure control, good diet, whatever the reason is. If you're below 120, below 80 on the bottom number, you're good. Elevated blood pressure between 120 to 129, and then again, that lower number still less than 80, right? So that top number, because the top number would typically creep up first. So that top number gets between 120 and 129, you are in elevated blood pressure. These are the people we tend to look at a little bit more. Hey, we start talking about your diet, we start talking about your salt content, we start asking about that family history, right? Because hey, this is not the time where I'm going to give you medication, but this is the time where I'm starting asking questions to let you know you are headed down the path to get some medications. Now, stage 1, 130 to 139, top number 130, 139, bottom number 80 to 90. Lifestyle changes, medications typically come into play at this factor here, and you definitely are going to see the doctor more than once a year, right? When you're in stage 1 high blood pressure, you're going to see us more than once a year, right? Because we got to make sure it stays stage 1 and go low. 140 and higher is stage 2, 90 and higher is stage 2, right? Dangerous. Medications are damn near required, right? Stage 1, you may be able to get away with diet, but stage 2, you're getting some medications and you might need more than one, right? So the person I'm talking, the guy I was talking about, his blood pressure when he came in was like 190. And you may be saying, Dr. Pierre, how did it get that high? Yeah, again, your body will do a great job until it can't no more. His blood pressure is 190. That's why he had the stroke, right? So it's extremely, extremely concerning that, yes, we think about lifestyle modifications, we think about diet, but when you get that high, you know what? You already know what the game plan is, right? You are going to get some medications from that standpoint here, right? So very, very sure to understand that. Like, and again, and this is what I always say, right? Especially for those who may be thinking like, Doc, I don't even know my numbers. Go to the pharmacy right now, right? One of your CVS's, one of these pharmacies, or Publix's, if you're near Publix, I'm in South Florida, so we got Publix down here. I don't know what grocery stores you got over here. I feel like Walmart may have blood pressure cuffs. I gotta check. Like, that's a good call. I'm almost sure Walmart has a blood pressure cuff. I'd be surprised if they don't, right? Especially around their pharmacy section, right? But like, go to a place where you can get your blood pressure checked, write that number down, and don't just take the first time you do it, I'm good, right? It's like, hey, get your blood pressure in the morning, get your blood pressure in the afternoon, get your blood pressure in the evening, right? You want to have some type of average so that when you do go to see your doctor, say, hey, doc, I've been taking my blood pressure every morning, it's this number. I've been taking it every afternoon, it's this number. I've been taking it every night, it's this number. And I'm just saying you have to do it for like 3 months before you go see a doctor. No, like after a couple of weeks, you have a pretty good idea of where you live at, right? So again, that's important. Again, go to the doctor, seek help, especially when you get into elevated, right? When you get elevated, you should be going to see somebody, right? But definitely stage 1. Elevate again, change your diet, watch, again, because a lot of times family history plays such a big factor. You could be eating, no salt all your life. It don't even matter if you got a good enough family history, your pressure is going to be up, right? So understand that it's important. Another blood test, right, I think is very important is the cholesterol, right? Like, and this cholesterol is a big one. One, because it is something that you're definitely not going to feel, right? You're not going to feel when your cholesterol is creeping up, right? You're just not going to feel that. It is something that you have to be very diligent of. This is where we're definitely asking about diet. We're definitely asking about family history because genetics plays such a significant factor. At the time I'm recording this, Eli Lilly is working on an infusion medication, right, that can significantly reduce your total cholesterol panel from due to like genetics and whatnot, right? Sounds amazing, except if you're like one of these anti-government, anti-vaxxer Venn diagram folks who thinks that anything in medicine, technology-wise, is like against your will and whatnot. Different conversation, but like, yeah, that's gonna help save some lives, right? So understand that cholesterol is important. There's different factors of cholesterol. There's total cholesterol. There's LDL cholesterol. We consider this the bad cholesterol. And the reason why we consider it bad cholesterol is because this is the type of cholesterol that will bring cholesterol and plaque to the arteries, right? Versus your HDL cholesterol, your high density lipid profile, that will take those plaques and move it back to the liver, right? Just so you can kind of get an understand of what cholesterol is, right? Because again, cholesterol is just a measure of like fat particles in your blood, right? And then triglycerides, this is another type of cholesterol. You see all the time these foods that are quote unquote high in triglycerides, high in fatty fats, right? Triglycerides are definitely ones where you tend to be wary of, right? And triglycerides are one where, like, for those who get blood work, a lot of times you have to get it fasting, right? And the reason why I have to get it fasting is because a lot of times we're checking your cholesterol. And if we're checking your cholesterol, your triglycerides are so sensitive that if you eat something right before you do your blood work, maybe like say an hour or so, it can actually affect what those numbers are, right? So that's why we tell you don't eat anything for it, right? So again, total cholesterol, right? So we're breaking down again for your cholesterol panel. Total cholesterol, we want it below 200, right? Above 240 is a problem, right? You're getting medication. Your LDL, that's the problem cholesterol. We want it below 100. Below, once it starts getting like above 130, your LDL cholesterol, the bad cholesterol, once it starts getting above 130, we start trying to do some interventions, right? Because again, there's heart disease, there's strokes, there's kidney disease. All of these things happen when plaque built up goes towards the organ, right? Because again, where do you think it's going? Right. When we talk about plaque buildup, they're sending the plaque and they're building it up in the brain, right? Stroke. They're sending the plaque and they're building it up, right, in your heart attack. They're sending the plaque and they're building up in your lower extremities, right? Peripheral arterial diseases, right? So again, there's a reason why blood flow decreases like in your vessels, right? Because plaque buildup increases in those vessels, and the LDL has a big issue with that. HDL, this is our protective. We consider this the good cholesterol, the protective cholesterol, because these will actually remove plaque, send it back where it needs to go, right? Above 60, you're good to go, right? And usually, I can tell you, yes, there's some dietary things that may help this, but usually if you have great genetics, your HDL can be high, right? Like I know for me, like mine's numbers is typically above like 60, right? And that's just genes. Trust me, that ain't what I'm eating. That's just the genes, right? And then triglycerides we like below 150, right? So understand, right? It's when it comes to cholesterol, because cholesterol has like 4 different moving parts, unlike blood pressure that has 2 moving parts. There's always things we factor in, like, all right, is your triglycerides high? Okay, there's a certain medication for that. Is your total cholesterol high? Certain medications for that, right? Is your HDL high? Good sign. LDL high? Okay, we got to do something about that, right? So there's things that your doctor will have to interpret based off your family history, based off your labs, based off any prior labs, if they've had prior labs, just to kind of see where you're going from a dietary standpoint before they start initiating medication, right? But medication is definitely where it's at, right? So, and then this is a myth we'll get it right out the way, especially when it comes to cholesterol. I should eat no fat. That doesn't make any sense, right? No, like your body needs fat. Your body, again, your body just needs fat, right? Like it just is what it is, right? So you got to absorb vitamins, hormones. You got to fuel your brain. So yes, yes, are there bad fats? Right? That's the question, right? Are there bad fats? Yes, there are bad fats, saturated fats, trans fats, but good fats like olive oil, avocado, fish, walnuts. They're again, it's not all good, it's not all bad, right? Just understand that that's what we have to factor in, especially when we're thinking about making those changes in our life. Right. When we're thinking about making changes in our life, that's why it's not a one size fit all for everyone, right? Because what may work for someone will not work for someone else. And you have to be able to know that and recognize that, right? Another blood test I want to talk about, right? This is the A1C. A1C, I think, is extremely important, especially for cardiovascular disease risk, right? Because the A1C, right, I always tell my patients, it's like the test grade that you got for how well your blood sugar has been controlled in the past 90 days, right? Like you could tell me all you want, right? You can tell me all you want. Hey, doc, I've been great. My sugars have been great. I've been eating great. My sugars are always low. And then I get that A1C, and that A1C tells the truth every single time, right? And then I can say, well, your A1C is kind of high still. Like, and we can factor in based off your A1C number, we can give an average of what your sugars are on a typical daily basis, right? So A1C, again, 3-month average for blood sugar. Again, and extremely important, right? And again, because your blood sugar will fluctuate on a daily basis, depending on what you eat, what you're exercising, when you sleep, it's important to know, right? But this is why, right? And I talk about this all the time with diabetes, right? This is why I say, like, you got to be on your P's and Q's, especially when it comes to diabetes. Diabetes damage can lead to blindness, right? Leading cause of blindness. Diabetes is a leading cause of kidney failure. Diabetes, leading cause of foot amputations. Diabetes is a leading cause of heart disease. It flips back and forth between it and hypertension. But yes, if you are uncontrolled diabetic, or you're just a diabetic in general, you are going to have an increased risk for these issues, right? So again, diabetes is nothing to play with. I can assure you, diabetes is nothing to play with when we're thinking about, like preventative measure, preventative care. And that's why we go so hard for it, right? Like just those 3 things alone, right? Your blood pressure, your cholesterol, and your diabetes. If you have a handle on that, oh my God. Right. I don't know what to tell you, man. If you have a handle on that, like you're killing it, right? So again, a normal A1C, 5.7 and below, non-diabetic, 5.7 to 6.4, we start calling you're in that pre-diabetic stage. You're in that stage where we're definitely going to harp on diet. We're definitely going to harp on lifestyle management. We're definitely going to harp on making sure, like obviously assessing your family history, but you can't change nothing about your family history. Your family history is your family history. But we're definitely going to harp on the things that we can harp on. 6.5 and above, you're diabetic, you're getting some medications. It just is what it is. You're getting some medications because the goal is to make sure we can reduce the risk of complications. And once your A1C gets about a 7, once your A1C gets about a 7, y'all, like it's going up, right? Like complications are rising in that regard. So lifestyle modifications, again, losing weight, exercising, eating more fiber, reducing your alcohol intake, managing stress. A lot of y'all can't manage our stress. These are all things that, we do not play with when it comes to that, right? So again, it's important to understand that we're diligent when it's early, right? When it's early, we're trying to be diligent, right? Like, all right, you're in that pre-diabetic stage, right? You're in that pre-hypertensive stage. We are going to be aggressive, right? Your cholesterol is kind of borderline. We want to be aggressive there because we don't have many options when you're on the other side, right? When you're the 42-year-old guy who's sitting in my ICU, right? Because you done had a stroke. And now I got to talk to you about why your heart is, and I can't even say you have an old person's heart because old people, right, don't have heart ejection fraction of 10%, right? Old people are people who don't take care of their heart, who've had serious heart attacks, getting an ejection fraction of 10%. But old people in itself don't get it. And then this is one of the big screening tests I like talking about, right? Like there's two of them, right? But big one, colonoscopy, right? Colon cancer. Man, colon cancer is such a significant issue, right? Because colon cancer is so disheartening because it's so preventable, right? And that's honestly, I hate to say it like it is so preventable. Like if you just get the screenings done, right? Like the fact that we have people who still die from colon cancer because they just did not get the screening done. They missed the warning signs, right? Right. They didn't get the good family history, right? Is so saddened, right? So again, understand that colonoscopy, I think, is extremely, extremely important. And again, a lot of times the colonoscopy, I don't want to say it is a quick procedure, right? It's like 15 to 30 minutes, right? Like that's nothing for a procedure, right? You're not fully sedated, right? Like you're kind of half sedated because you need to be able to move around and kind of follow directions. So you're kind of half sedated. You forget things, right? But the important thing, right, especially with the colonoscopy, is one, checking your colon, right? And we've talked about this from an age perspective, right? So starting at the age of 45, I'm 41 going on 42, right? Like starts at age 45, we start saying, hey, you know what? You need to get screened for colon cancer, right? It used to be 50. When I was in medical school, this thing was 50. And then if you have family history, you can move it down, right? Now they moved it down to 45. Why? Because they were missing a lot of people in that 45 to 50 range. Right? So they said, hey, let's move it down, right? So they're catching it. They're catching up to people a little bit earlier. And again, if you have family history, this is why it's nothing like cancer screams the importance of family history, right? Because if you have a good family history, a lot of these screenings we start checking much earlier, right? Whether it be the colonoscopy that we talked about, whether it be like mammograms, like a lot of these things happen a lot sooner if you have a family history that says I need to check for this sooner, right? Start at the age of 45, typically every 10 years. If it's normal. Now, if they do find polyps, which is pretty common, right? Because it's pretty common when you get a colonoscopy, for those who've had it, where they find a polyp or two, right? And that polyp could be precancerous, right? That's what we want, right? We want to get it when it's a polyp stage and we could snatch it up out of there, right? Because what happens is if it becomes a polyp stage and it's precancerous and it does not get found, guess what? That polyp becomes a mass. The mass becomes cancer, problems, right? So we want to catch the polyp stage. Obviously, we want nothing. If we could ask for something, we would want nothing, right? Like if I could say, hey, pick and choose which one would I want, like, yeah, I'll take the polyp versus taking the actual mass and that's blocking, part of my colon. No. So we got to catch this thing early and they grow slow, right? So again, family history, you start at age of 40, what we kind of mentioned. And again, signs and symptoms we always talk about in our colon cancer episode, right? Diarrhea, constipation, blood in stool, weight loss, all of these things. Like if you start having changes, right, in your bowel habits, you need to go see a doctor, y'all. You start having blood in your stool, right? And of course, I know the people who suffer from hemorrhoids, or be like, oh, I always have blood in my stool if I get strained. Yes, I understand that, right? But again, even if you have hemorrhoids, right, you should be very like, you don't want to say, hey, I got hemorrhoids, so if I see blood in my stool, it's just a hemorrhoids. No, you don't want to play that game, right? You want to be a little bit more diligent and making sure, like, all right, is this hemorrhoids or is this something else, right? You gotta be careful when we think about it, right? So again, what I think is important, right, especially when we think about the colonoscopy, right? And these are some myths, right, that usually get us from not getting screened for colonoscopy, right? People think it's humiliating. Oh my God, it's humiliating. Sir, ma'am, you're asleep. Like, and I always say this, right? Let me say this. How do I say this? I always say when it comes to your health, your pride should be at the door. You should leave your pride in the car. You shouldn't be trying to bring your pride when it comes to trying to take care of your health, right? A lot of y'all are, right? So a lot of y'all think because it's humiliating, you don't want something stuck up your butt. I'm not going to get called out to speak. That's crazy to me. People think it's painful. It is not, because again, you're asleep. Now the prep, let me look at me after that. That prep, if you ever talk to someone who's had a colonoscopy and they tell you about the prep, most people talk more about the prep than they talk about the procedure, right? Because the prep is, because again, you need a clean colon. So we're going to give you medication that cleans you all out, right? So most people don't like the prep associated with the colonoscopy more than they don't like the actual colonoscopy. It's risky. Yes, it's risky, but complication risk is about less than 1%. I don't have any symptoms and I don't need it. That's the same thing as saying I don't feel fine, right? Ask my 42-year-old who's had a stroke now about that. And if they find something, that's bad news. Again, no. Finding polyps, again, I kind of talked about this. If you find a polyp, that's great. That means we caught it before it became cancer, right? Polyp remove equals cancer remove. Polyp remove, cancer remove. I want y'all to think about that. Polyp remove, cancer remove. Like it is what it is, right? So, you know what? I got some more. But I'm gonna stop there because I don't want to inundate us with all of the blood tests that we got, right? Because typically, especially in your preventive medicine, you're probably getting like a CBC, which is a complete blood count, right? Which would typically check for your white blood cell count, which could show for any signs of infection, even cancer. Your anemia, your hemoglobin, hematocrit, that's for your blood count, your anemia, your iron storage, your platelet counts, another thing as well too. So that tells us a lot as well. But like, yeah, we won't go into significant detail about that, right? There's a lot of different blood work that happens, right? But what I want you to get is understand that your blood work is important. Just as important as it is to get to the doctor and ask them the right questions, getting that blood. Because again, the amount of people who will go to the doctor office, have a great visit, and never get any of the blood work or the test that the doctor orders. I don't know, y'all. I don't know how y'all do it, but a lot of y'all do it, right? So again, just to recap, remember, things we need to know and understand is our blood pressure. Know where we live at. Right? And again, if you don't, first of all, before we almost get out of here, right? Make sure you're subscribed to the show, right? Make sure you hit that notification bell, right? Leave us a comment, right? Let me know, where do you live at when it comes to the world of blood pressure, right? Like, are you normal stage? Are you pre-hypertensive, stage 1, stage 2? Let me know where you live at, right? Because again, we gotta be accountable for each other. Cholesterol panel, again, is the big one, right? We kind of talked about the 4 different pillars of your cholesterol panel, so you kind of get an understanding of how to manage that. Your A1C, that's that report card. That's the report card that y'all don't like. Y'all may try to turn in someone else's homework, but your A1C is your homework only, right? When it comes to how well your blood sugar is controlled. And we kind of talked about colonoscopy, but again, you swap out colonoscopy, especially for my women. Think about the mammograms, right? Think about the mammogram, right? I've told this story before about my patient who never got a mammogram, ended up having cancer so bad that it was growing out of her chest, right? Like, get the mammograms, y'all. Like, stop playing games, right? So again, that's what we want to do here. Understand that in the pursuit of happiness and healthiness, right? In your preventative landscape, the blood work is a significant factor, right? Your blood work and your tests, right, are significant factors, right? So again, it's one thing to talk to the doctor. It's one thing to go and get the checkups done. It's another thing to then make sure that, guess what your doctor is thinking about like they get to be able to like follow, right? So they get to check to see what your blood work is, right? They get to have a good progression. Like, all right, your blood pressure was this on this visit. Let's see what it is in 3 months. Let's see what it is in 6 months, right? We got to know what the progression looks like, right? So extremely, extremely important to understand, because that's what it is, right? Again, your blood work is your body's report card, right? It's telling you something, right? So whether you want to know what's on your grades, I would suggest you should, right? Or you could be like my patient, right, who didn't know what was on his report card, and now he's in a hospital with a stroke. Now he's in a hospital and he has to get like a left heart catheterization, all these things here, right? If you don't want to be that person, right, find out what's on your body's report card, right? It is what it is, right? Again, that's my goal. That's how we stay healthy out here. I'm yours truly, Dr. Pierre. Thank you for joining us for another episode of Medicine Mondays. I'm gonna see you guys next week. Good night.